My husband has been diagnosed with celiac disease and follows a gluten-free diet, but occasionally he will cheat and knowingly eat something that contains gluten. Although he doesn't typically display symptoms, might there still be negative consequences that we can't see?
We recommend and enforce the so-called zero-tolerance policy for gluten in terms of managing celiac disease. This is the best way of managing the disease. Just try to remain as possible gluten-free. That said, voluntarily being exposed to gluten is never a good idea. So I would suggest your husband tries and change his attitude toward that. That said, the symptoms that people experience when eating gluten are really very different. There are those who react within an hour or so, feeling nauseous, throwing up, having lots of abdominal discomfort, etc. And on the other end of the spectrum, there are those who actually feel absolutely nothing and they feel they can go home and maybe having again gluten exposures at their leisure. Unfortunately, these exposures, especially if the amounts are not really trivial, are bound to cause reactivation of the inflammatory process in the intestine. So they will simply reactivate the disease. So cheating now and then or eating gluten-freely every day is the same thing in terms of the reactivation of the disease, and it's something we strongly recommend not to do.